Right. All right, now we're in business. So hello and good evening, everyone, and welcome to the Public Health Museum's 2025 annual meeting. My name is Amy Consalvi. I'm a current member of the board, and on behalf of the board, thank you all for being here tonight. Before we get started, I just kindly ask for everyone to stay muted, and ideally, if everyone could also turn off the video so we can focus on the talk. Tonight's program will be about an hour long, and it will be followed by a moderated Q&A with Dr. Al DiMaria, who is also a member of our board. I do want to note that tonight we will not be taking questions from the audience, so please just keep that in mind. But I think this is going to be a really great discussion between Commissioner Goldstein and Dr. DiMaria. And then after the presentation, we'll do another short presentation on the museum's operations report for 2025. So it is my pleasure to introduce the commissioner. And so Commissioner Robbie Goldstein oversees a public health workforce of over 3,200, an expansive department comprised of 8 bureaus and several offices responsible for a range of programs, including environmental health, infectious diseases, injury prevention, and maternal and child health. In addition, the department licenses health professionals and facilities that impact public health and operates the State Public Health Laboratory and 4 public health hospitals. Goldstein was appointed commissioner by Governor Healy in April 2023. Previously, he served as senior policy advisor at the Centers for Disease Control and Prevention, where he focused on public health emergency response, infectious diseases, and CDC's strategic policy initiatives. Prior to his time at CDC, Goldstein was the medical director and founder of the Massachusetts General Hospital Transgender Health Program, a multidisciplinary clinical program that created a safe and affirming environment for the transgender and non-binary community of Massachusetts and New England. Trained in infectious diseases with a specialty in HIV treatment and prevention, Goldstein has focused his clinical work on providing care to those living with and at risk for HIV. His experience caring for patients drives his academic and policy pursuits, identifying and working to eliminate barriers to equitable access to care. So with that, I turn it over to Commissioner Goldstein.
Thanks, Amy. And good evening, everyone. It's great to be with you. I will say I was originally going to present slides, but I'm not going to. So bear with me here. I don't think the slides are necessary for this talk. But I want to start by thanking the museum, the leadership, the board, the members, the donors, everyone who helps to keep the Public Health Museum thriving. Your work collectively is preserving artifacts and understanding of public health. It's about keeping alive the lessons, the courage, the achievements, and also the missteps of our past so that they're visible, instructive, and inspiring for the generations that follow. I'm particularly pleased to be here with you during the period when our nation collectively is celebrating its 250th birthday. Because, excuse me, the story of public health is the story of our nation. Our progress as a nation, our ability to live freely, to thrive, to build, and to dream has always been intertwined with our ability to protect health and to prevent disease. Liberty and health are not separate. They never have been. They rise and they fall together. 250 years ago, lanterns glowed in the steeple of Boston's Old North Church. A horse galloped through the darkened streets of Massachusetts, and a shot was heard round the world. Paul Revere's Midnight Ride on April 18, 1775, has become the stuff of legend, a symbol of bravery and awakening. It marked the beginning of the fight for independence, a moment when ordinary people took the extraordinary risks for freedom. But what many forget, or what maybe many never knew, is that even as Revere rode through the night and colonial troops prepared to face the British Army, another enemy was already among them. It was invisible, it was microscopic, and it was smallpox. See, in 1775, as the Continental Army gathered, Boston was in the grip of a smallpox epidemic. And over the 8 long years of war, more than 25,000 American soldiers would die. 2/3 of them, not from battle wounds, but rather from disease, and much of that was smallpox. At the time, medicine was primitive by today's standards. Hygiene in the encampments was poor, and people were crowded together in unsanitary conditions. Also at the time, inoculation to smallpox existed. Although it was controversial, it was highly feared, and it was widely misunderstood. The process involved scratching material from a smallpox sore into a healthy person's skin, invoking what was hoped to be a milder form of the disease. Public sentiment ran high against it. Many thought it was reckless or even ungodly. The colonies themselves were divided over its use. But one important figure in the Continental Army, General George Washington, who had survived smallpox himself, saw what many others did not. He understood that disease posed as great a threat to independence as did the British Army. And so in 1777, he made a bold and a visionary decision. He ordered the mass inoculation of all Continental Army soldiers. It was the first medical mandate in American history. It was risky, it was unpopular, but importantly, it worked. That single decision, grounded in evidence and courage, saved thousands of lives, and it likely changed the course of the war, and by extension, the course of history. Washington wrote to Dr. William Shippen Jr., the Director General of Hospitals for the Continental Army, saying, quote, "Necessity not only authorizes, but seems to require the measure. For should the disorder infect the army in the natural way, we should have more to dread from it than from the sword of the enemy." He knew even then that science and survival were deeply connected. After the war, Paul Revere, the silversmith who had warned his fellow patriots that the British were coming, took up a different kind of fight. He became Boston's first health officer and the first in the new nation. He helped develop quarantine measures, improve sanitation, and educate the public about hygiene. The same courage that had sent him riding through the night became the foundation of his work to protect communities from disease. So see, woven into the very origins of this country is a simple but profound truth. The fight for freedom has always included the fight for health. And those who led our revolution, Washington, Revere, and so many others, understood that leadership meant facing not just visible enemies, but invisible ones as well. That is part of what makes this public health museum so essential. Because public health is a discipline that can be easily to overlook when it's working well. It's the background hum of safety, the clean water, the vaccination record, the inspected restaurant, the quiet preparedness for a crisis that never happens. But this museum reminds us that behind every triumph and every challenge in public health are stories. Stories of people, of choices, of courage, and of doubt. And it's these stories that show us how progress is made, how fear can spread, how science evolves, and how leadership can change the course of history. This isn't just a museum of artifacts and archives, it's a museum of stories and of lessons. And those lessons, perhaps, have never been more relevant than they are today, because once again, history is repeating itself. Today, we're seeing the return of diseases we thought we had conquered. Measles, which we declared eliminated in this country a generation ago, is back. Pertussis, or whooping cough, is on the rise. And the very idea of vaccination, one of the greatest public health achievements in human history, is being questioned, doubted, and distorted. We have the tools to prevent disease. We have the science, we have the evidence. What we're fighting now is not just viral enemies, but misinformation, fear, mistrust. And that makes the lessons of history all the more urgent. 250 years ago, inoculation was seen as risky, dangerous, heretical. Today, vaccination faces many of the same headwinds: suspicion, politicization, confusion, and yet across the centuries, the stakes are the same. Lives are at risk. The difference is now we know better. We know what happens when fear wins out over fact. We know what happens when inaction and ideology replace science. Every generation faces its own version of smallpox, its own test of courage and conviction. Ours may not come from an 18th century virus, but it comes from the same place of uncertainty, the same tension between personal belief and collective responsibility. For my generation, for me, this was the HIV/AIDS crisis. As a teenager and a young adult, I was both horrified and fascinated by the continuous news reports about a mysterious, deadly illness that was spreading infection, as well as stigma. Young people, particularly gay men, people who use drugs, those who received blood transfusions, were dying at an alarming rate. Treatments were non-existent, misinformation was rampant, fear was high, and so was discrimination. Physicians who tried in vain to treat the deadly illness faced daunting challenges. Patients were presenting with rare infections and cancers, and the top scientists were struggling to understand what was happening. The sense of helplessness, the urgent need for answers, the compassion required to care for those affected left a profound impression on me. And so did the power of disease detection. You remember the alert. 5 young men, all active homosexuals, were treated for biopsy-confirmed pneumocystis carinii pneumonia. It was an alert put out to the world with the best technology we had at the time. It drove discovery. It gave clinicians and public health practitioners around the world the knowledge they needed to manage the public health threat in front of them. That ping, as we call it today in the MMWR, awoke a generation of scientists, and it altered the course of our history. In addition to HIV, since starting my journey into medicine and public health, I've been involved directly or indirectly with outbreaks of SARS, H1N1, MERS, Zika, COVID, Ebola, Mpox, and now H5N1. And I would say, despite the gray in what remains of my hair, I'm actually not that old. Each of these pings went out like a siren. They called us to the complicated work of public health and outbreaks. Collectively, the diseases have taught us one enduring truth. We cannot afford to be caught off guard. Individually, each of these diseases has provided us with new and vital information that we can apply to the next outbreak, and the next, and the next. SARS showed us that a respiratory virus can travel across the globe in days. Zika demonstrated how vector-borne diseases can leave generational scars. COVID taught us painfully at times what happens when our systems are too slow, our signals too siloed, and our politics too fractured. Mpox reminded us that vigilance at the local level can prevent a national crisis. My friend and mentor, Dr. Nestle Basgaz, brilliantly diagnosed the first case in the United States. It was a rare moment when clinical excellence met public health's need for speed. And now we have H5N1 as a reminder that we can't wait for a virus to mutate into a human threat before we prepare for its arrival. As public health professionals, as community leaders, as citizens, our charge is to use what history has taught us, to bring forward its lessons in how we communicate, how we build trust, and how we lead with evidence, even when it's hard or unpopular. And that's why this museum, as a repository of the past, is also a guide to the future. It reminds us that science without humanity can lose its way, and that policy without the perspective of science and evidence can repeat the same mistakes. The Public Health Museum keeps alive the stories of both success and failure, and we need both. We need to study and understand the breakthroughs and the blind spots, the triumphs and the tragedies. Because public health at its core is about learning and about turning experience into wisdom and then turning that wisdom into action. So as we mark 250 years since the founding of the nation, I urge us all to remember that our independence was secured not only by muskets and courage, but by science and public health. The promise of liberty includes the promise of safety, and the freedom to live well depends on the ability to stay well. That shot heard around the world may have started a revolution for independence, but the shots we give today, the vaccines that protect our children, our families, and our neighbors, continue that revolution for health. Every vaccination is an act of prevention. Each vaccination is an act of care. And in its own way, every vaccination is an act of patriotism. 250 years later, the promise of freedom, justice, and liberty endures. It's through public health, through science, through service, and through our shared commitment to one another that we keep that promise alive. So thank you again to this museum and to all of you for keeping the story and the spirit of public health alive for generations to come.
Thank you, Commissioner, for inspiring presentation and the historical context and the support for the Public Health Museum. As we hear so often, we live in challenging times, and I know you have done a lot to address some of the issues that we're facing. And could you tell people about the collaboration among the willing states to work together to fill some of the gaps that have resulted from the federal government's changes in policy?
I'm happy to. I don't think we've yet been described as a coalition of the willing, although perhaps that's the best description for what we are. For folks who don't know what I'm referencing, what Dr. Al is referencing, really about 10 months ago now, a coalition of states across the Northeast came together, recognizing that while we had previously relied on the federal government for support when it comes to public health, we were unlikely to get that support during this federal administration. And so we formed what's now called the Northeast Public Health Collaborative. It's a collection of states and cities from Washington, D.C. up to Maine. And we work together on a variety of issues, mostly work that actually was happening before the Trump administration, but work that we've more formalized. We've divided ourselves into 4 working groups, one focused on vaccine policy and vaccine recommendations, a second focused on emergency preparedness, a third focused on disease surveillance and epidemiology, and a fourth that is focused on our laboratory capacity and shared resources across public health labs. The reason we chose those are that, one, those were areas where we received a lot of support from the federal government, and we are not sure that we'll continue to get that support. And two, they're areas that really transcend politics, or they at least should transcend politics. We, I think, can all agree that we all want functioning state public health laboratories that can test for rabies and can understand if a case is measles or chickenpox or mpox. And so we need to make sure that those capabilities persist, even if the federal government removes its support from the laboratories across the Northeast. We've had some success since our launch. Notably, I think we have some success in the vaccine space. We put out joint recommendations across the Northeast Public Health Collaborative on COVID-19. Those recommendations actually mirrored what happened out on the West Coast with a similar alliance called the West Coast Health Alliance. They actually look quite similar to what came out of ACIP after many weeks of consternation and fear that ACIP may not vote that way. But what we thought was what was so powerful is that we came together, we all analyzed the science, we used the science to make recommendations, and then we communicated those recommendations in a way that made sense for each of our jurisdictions. And I think that it makes the recommendations that much more powerful for all of our communities. So I think we have other examples where I can talk about success, but I think that the main point to take away from the work of the collaborative is that public health is going to persist, right? That no matter what happens at the federal level, no matter what is happening in the White House or in the federal health and human services agencies here in the Northeast, we recognize the value and the importance of public health that goes across state lines. Remind folks that across the Northeast, there are Republicans and Democrats and independents. There are red states and blue states and purple states. There are governors of all stripes. There are legislatures of all stripes, and yet we've all come together around the importance of public health.
One specific issue that you talked about is vaccination is patriotism, and Massachusetts has had a universal childhood vaccine program essentially since 1904 with smallpox and Theobald Smith. And as new vaccines came into existence, an application has provided all of these vaccines for the children and still does to this day. But now there's the potential that that vaccine supply may change, and changing recommendations may impact the system. I know the department did a great program. I think it was last week with the Medical Society. Could you talk about some of the things that are in play to make sure that we can get all the children vaccinated with all the recommended vaccines?
Yeah, there's a lot at play right now. I like that you go back to the early 1900s for our universal vaccine program. I usually say it's been around for a few decades, but I think you might be correct that it's been around for over a century at this point. We're really proud of it. You know this. We're very proud of our program here in Massachusetts. And I think important to say the governor is really proud of it. And I've had many, many conversations with her about the importance of universal access to pediatric vaccines. She is so proud of it and so committed to it that we have put forward a number of statutory changes over the past 6 months so that we can guarantee access to pediatric vaccines. Some of that is kind of in the weeds, but it looks like new language so that our Massachusetts Vaccine Purchasing Advisory Committee, which is the group that decides which vaccines we cover and which vaccines we don't, is no longer bound by ACIP recommendations and can now take into account recommendations from professional societies, from the commissioner, from other parts of the department when making those recommendations. We have really severed the connection between ACIP and their recommendations and what we think is right here in Massachusetts. We're doing the same when it comes to our school entry requirements so that the department has the ability to state what are the recommended vaccines, and we are not dependent on ACIP to make those decisions. That feels necessary in this moment at a time when ACIP has a membership that isn't committed to science, that isn't willing to look at all of the evidence, and therefore there is a risk that some very important pediatric vaccines could be removed from their recommendations. I think the other important thing that we've done is that so much of the current version, the modern version of our universal vaccine program is dependent on a federal program, the Vaccines for Children program. We use the Vaccines for Children program for purchasing. We use it for distribution of vaccines. We use it to help maintain the stock of vaccines in pediatricians' offices, community health centers, local public health. And we are setting up a parallel system here in Massachusetts, one that can purchase, distribute, and maintain supplies of vaccines across the Commonwealth, because we are nervous that if the federal government were to remove its support for the Vaccines for Children program, if there were different recommendations of vaccines in the Vaccines for Children program, that it might limit our ability to get the vaccines into this state. And I will say that this is a parallel system that I hope we will never need to use. But the past few months, we have in many moments where we have felt we were on the precipice, we were about to activate this new system so that we could get COVID vaccine, hepatitis B vaccine, MMRV vaccine into the state if for some reason the federal government were to not include it in the Vaccines for Children program. I think that there are likely additional steps we're going to have to take over the coming months and years as we see how the Trump administration uses policy, law, rules at the federal level to change access to pediatric vaccines. But I do have to say that I feel really fortunate that I get to work in an administration here in Massachusetts that is so committed to pediatric vaccination. And we really do have the support at the highest level to get done what needs to be done to maintain access.
Thank you. And we talked about collaboration across states. Last year, SAFE 2.0 finally passed after years of discussion in the legislature. And how do you, and that basically authorizes shared services across local health jurisdictions. We have a lot of people who are involved in local health here with us this evening. How do you see that as going, and where do things stand from your perspective?
It's been about a year since SAFE 2.0 was passed. It was passed as part of the Economic Development Bond Bill at the end of last year of 2024. And I think SAFE 2.0 does a tremendous amount to support local public health, right? So the combination of SAFE 1.0, which was passed a few years ago, and SAFE 2.0 establishes standards for local public health. SAFE 2.0 mandates adherence to those standards. SAFE 1.0 allowed for shared services. SAFE 2.0 really incentivizes the use of shared services across the state. SAFE 1.0 talked about the need to invest in workforce, and SAFE 2.0 sort of formalizes that investment in public health nurses and certifications for various levels of workers across local public health. So there's a lot that was formalized in passing SAFE 2.0. Like I said, we're about a year into implementation. I think we've made decent progress in implementation. We have a lot more work to do. Some of that is about securing sustainable funding for local public health and making sure that our funding, which currently lasts till around the end of fiscal year 27, so that's the end, that's July 2027, when that will end. We want to make sure that we have a way to continue to get money out to municipalities so that they can employ the right folks, maintain their certification and their trainings, and do the work of the shared services. What I've seen, just last week I did a bit of a tour out in Western Mass and visited Franklin County and Hampden County and talked to a lot of folks who are involved with shared services. And this takes time. Talk about a history here, right? We have 351 cities and towns. Local rule that is the rule. That is how Massachusetts is governed. That is centuries old. And what we're trying to do is create something different and say, you should come together, you're stronger together. Some shared service arrangements are doing it really, really well. Some are figuring it out, and others are going to need a bit of a hand. They're going to need some help to get there. But the department, and in particular, the Office of Local and Regional Health, is ready and willing to support folks as they move into these shared service arrangements and understand what it means to rationalize across 4, 5, 15 towns, to share data, to share humans, right, personnel as they go across into the various jurisdictions. We will get there, but it's going to take us a little bit of time.
And what would you tell people here this evening, and people who are going to listen to your presentation online? What can they do in these times as just ordinary citizens, residents of Massachusetts, to help the Department of Public Health and local public health to deal with what's going on?
Yeah, I think a really specific thing is related to SAFE 2.0, and as I talked about the need for funding, is to advocate, right? Folks in communities are the best advocates for those communities. They understand the importance of a strong local public health department, of having a public health nurse who can go out into the community and do the work. And so calling your legislator and calling your town manager and your mayor and advocating for continued sustained funding for local public health is a help to the department. It's a help to the greater good and to public health writ large across Massachusetts. I think, though, I don't want to miss the opportunity to reflect on a little bit what I was talking about in my prepared remarks and what we've talked about around vaccination. That now is a moment, and it's a moment when mis and disinformation are swirling all around us, and we have a choice to make. We can choose to let it swirl and to not address it, or we can choose to stand up for truth and for science. And we all know this, right? Mis and disinformation spread faster than the truth. They're more compelling than the truth often, right? Because it catches people's attention, it catches their mind in a different way, right? And people live in these silos where they follow a feed, and they live in the echo chamber of a particular mis or disinformation lie that might be coming forward. And I think it's our responsibility to always push back. And so I don't really miss an opportunity to say, I think it's been in every prepared remark I've given for the past year, vaccines are safe, vaccines are effective, vaccines save lives. And I think we all need to say that. And if each of us told 20 people every day, by the end of the year, we'd get to a decent percentage of the Commonwealth, and we'd be able to at least get our truth out as it's being confronted by the mis and disinformation that's coming from other sources.
Well, thank you so much for joining us this evening, and it's been wonderful to listen to you. And I think the right person is in the right place at the right time. Thank you for.
Thank you, Al. Thank you. It was a joy to be with all of you. Thank you for letting me come speak at this. And I know you have some business to do, so that's the more exciting part of tonight.
No, thank you. Thank you so much. Very inspiring talk. As someone who's worked in cultural heritage pretty much their entire life now, it really means a lot, everything that you said. So thank you again for being here tonight. So we'll transition to sort of a recap of the museum's operations for the year. This part of the meeting can be a little bit more casual, so I invite folks to turn their cameras back on if they'd like. And feel free, to use the chat if, you have any questions or kind of comments along the way. We certainly welcome that. And to my fellow board members on the call tonight, some of you I'll ask to just say a few words at a certain point, but otherwise, feel free to chime in if you feel compelled to do so. So just give me one moment to share my slides. Okay. All right, I think you can all see my slides. So we'll start with our attendance for the year. You see that we offer a robust lineup of tours throughout the years. We have our indoor tours of the museum itself and our galleries. We do cemetery tours, and that's a walking tour outdoors in the Pine Cemetery, which is across the street from the Tewksbury Hospital campus. We also offer outdoor tours of the campus itself. And if you haven't been to the museum in a while and you aren't sure what to do and it's a nice day, we always recommend the combination tours. And then we do receive a number of school groups throughout the year. And so we ended with a total of 793 visitors, which was great. This summer, I will say, was a little bit challenging for attendance. Normally, that's a high volume time, but I don't know if you all remember, this past summer, it rained pretty much every single weekend. So that was not ideal for our outdoor tours. Thankfully, once the beautiful fall weather came around, we kind of made up those numbers. National Public Health Week. This is a series that we run every year. Al, I don't know if you would like to jump in and say a few words about it, but we had a really great talk by Katie Brown about bird flu. We always like to offer an in-person naloxone training from Prevention Partners. They're a longtime partner of the museum. And then we typically have an open house, and we conclude with our local public health forum. We launched one new exhibit in 2025, and it was called Pandemics is Hindsight 2020. And what this exhibit does is really takes a look at COVID-19 and also the 1918 flu, and looking at the similarities, looking at sort of historical context, social context, what was going on in both years, how did the public respond, how did health officials respond. We have some really amazing artifacts on display, including one of our ledgers that actually indicates that someone admitted to the hospital had the flu. So. We partnered with the Tewksbury Public Library for several virtual programs. We had developed a series this year called Behind the Headlines because, as we all know, public health was in and continues to be in the headlines constantly. And there's a lot of talk about it. And so we really wanted to present the public with speakers who really knew their topics and really could shine a light on what the reality of the situation is. And then one of our own board members, Kate Benson, she presented a talk over the summer all about contagious disease hospitals. So thank you, Kate, for doing that program for us. We also had two large in-person events at the museum this year, both this fall. This was the second year of our annual community health fair. It's a big open house. We invite all of our partners and all of our sponsors to have a table, meet our visitors, talk with the public. We had a really fantastic turnout this year. Lightning talks were incredibly popular, so thank you. I think we have a number of our lightning talk presenters here in the audience tonight. Those were very well attended. And, this is also a great opportunity for the public to, stop in, not only check out the museum, but get their flu shot or get their COVID booster, as well as a number of other health screenings that we were able to offer this year. And then we sort of kicked off our October programming with a screening of Stonegate. This is not a program that's in our usual wheelhouse, but the reason why we screened it is because the film was actually it was shot on the campus of Tewksbury Hospital, and several of us happened to be at the museum one day. We saw some people standing outside the museum, outside the old administration building, and we said, well, this looks interesting. What's going on? And we struck up a conversation, and turns out it was a director and his cast, and they were filming Stonegate. And so they released it, and the director approached us about hosting a screening in the old chapel next door to the administration building. And it was just a fun night, something different for us, and really, I think, helped introduce a new audience to the museum, which is always wonderful. So I'd like to turn it over to Al and to Terry if they would like to talk just very briefly about this year's summer program, Exploring Public Health, Colleges, Careers, and Connections.
Back in 2013, we decided that one of the major problems with public health education is that people don't find out about it until late in their educational career. So we wanted to do something for high school students, and we started the program called Outbreak. We don't call it a camp because it's not technically a camp. It's an educational program in the summer, and every year we learned something new, and there were changes in the program over time, and then obviously big changes during the pandemic. And the most recent iteration of what was Outbreak is Exploring Public Health. And that was a one-day program at the museum, followed up by a series of evening Zoom programs in the fall. So it was June 27th, the last Friday in June. And and again, we learned that you can't pack too much in one day, which we tried to do, and we need to do something else in terms of other programming. But we also have an enormous resource. Uh, a, Someone who was a student in the very first outbreak and now is a public health professional and has continued to participate in the program now as a presenter. And I would really want to get Terry Clover's perspective on what we tried to do this year.
Yeah, I think this year's program went over really well. It was really good to see kids again in the museum in person. It's always nice when they can form that connection kind of beyond the Zoom screen. I do agree. It's just a lot of new information in one day for them, so it's a lot to retain, but sometimes that is easier in person than over a screen too. So it was good. I think maybe some kind of hybrid program in the future is always possible, but we had great presenters. We had good activities for the kids. We did the zombie outbreak. We had the epidemiology investigation. We had panel presentations. So it broke the day up very well. But I know we also had Glynis there and Nancy too. You guys want to mention anything?
Who have been with us since the very beginning.
That's right. Oh, and Paige.
Fantastic. And yeah, as Elle mentioned, we had our virtual fall programs. That was a sort of a follow-up to the in-person summer program. And you can kind of see the diversity of talks that we had. And most of these, and I do want to mention in case anybody in the audience is not aware, most of our programs are recorded and available on our website and on our YouTube page. So maybe Paige, maybe you could drop those links in the chat when you have a free second, or I can do that too. So wonderful, thank you. And actually, Paige, I'll turn it over to you to talk about our organizational sponsors and our sponsorships in general.
That's great. Thanks, Amy. Good evening, everyone. Thank you so much for joining us for that inspirational talk by Commissioner Goldstein and for sticking around to hear a little bit more about behind the scenes at the Public Health Museum. We've had an important year this year, and we're grateful for the support that not only comes from financial contributions, but also from professional development and organizational sponsors who lend their expertise to us so that we can continue to be a resource for the community in the pursuit of educating the public about public health. We rely very much on our Massachusetts organizations that represent a broad spectrum of professionals in the business, and appreciate and welcome their continued support. Organizations are vital to spreading the news about the museum to their membership, and we do offer and welcome many organizations for tours and host meetings at the facility, which we're delighted to be able to do and meet these people in person. And then we couldn't do what we do without the financial support of our community sponsors. We've made some important decisions and done some sharpening of our pencils, looking hard and fast at how we operate, and have strengthened our financial footing. And again, we couldn't do it without the support of our community sponsors who invest in not only the mission, but believe in Tewksbury actually as a destination and want to see a vibrant place for tours and education to happen. Whether it's our partnership with the Tewksbury Public Library, whether it is our sponsoring through the Give a Click program that we were very fortunate to participate in with the Jeanne d'Arc Credit Union. Again, we could not do what we do without their underwriting. So we want to thank them publicly for that.
I do want to mention that the museum is pretty much entirely volunteer run. And so, we definitely want to take a moment to thank everybody that's involved with making this all happen. But I do first and foremost want to thank our museum coordinator, Amber Woods. She put together this presentation. She does all the work behind the scenes. She works very closely with Paige and I and Al. She's the person greeting the visitors. She's working with our volunteers. She does a lot. And she's part-time. And she's been with us several years now. So I do just want to give her that little shout out. You're looking at the list of our 2025 board. A lot of names you will probably recognize, but we also have some new board members that joined us mid-year, Kate Benson and Terry Clover, who we're delighted to have join our board. We have a number of committees that function with different parts of the museum. And again, we could not do what we do without them. It takes a lot of time and planning to put on the events and programs that we do. We understand that everybody has a life outside the museum, and so we really appreciate all the hours that they put into the museum to make it a success. And of course, that C3, formerly Outbreak Committee, a lot of these folks have been involved since day one, and we really appreciate their continued support. We also, apologies, I forgot to update the title. We also have 3 committees, 2 dedicated to exhibits and collections. The collections committee, we are responsible for sort of overseeing collections management, everything from reviewing donations, approving, or sometimes declining donations, making sure our collections are being properly cared for, rehousing them. There have been a number of large archiving projects happening this year, and we also implemented an integrated pest management system, and so we're better monitoring our collection spaces to ensure the future of these materials that we're caretakers of. The exhibits is sort of a subcommittee of the collections committee. This is a committee where people can kind of hop on, hop off, depending on what the project is we're working on at the time. And the folks listed here are working on redesigning our nurses exhibit. So we're having a meeting this weekend to kind of go over the big idea. So hopefully we'll be presenting on that new exhibit this time next year. And then finally, the events committee, these are the folks working to find speakers and make connections for the museum and, really think about what's going to make a compelling program for our audience. I wanted to just briefly highlight the accessions that we worked on this year. The material comes from a variety of sources. Some of this is what we refer to as found in collections, meaning that it's been in our space for a number of years. We perhaps don't entirely know where it came from or who donated it to us, but it's in our care. It fits with the mission of the museum and fits within the scope of our collections policy. And so we make the decision to accession it into our collections management system. And then we also received a number of donations throughout the year. One of my favorites was this Johnson & Johnson first aid kit, which is perfectly intact. And, you have everything from tiny little aspirin bottle to Band-Aids and to some other more peculiar remedies of the time. So I'm very sad to report that our longtime board member and former president of the museum, Kathy Demoto, she has made the decision to step down from the board after how many years, Al? I mean, she was essentially there she was the beginning.
Yeah, close to 20 years.
close to 20 years.
Plus,
I
plus the involvement as the medical director at the hospital since the beginning of the museum.
very long history with the museum. Outbreak is because of Kathy. She was my sort of first introduction to museum board members back when I was an intern at the museum. Gosh, what, 11, 12 years ago now, which is crazy to think about. So many people associate the museum with Kathy. So we are very sad to see her go, but excited for the next chapter, for her. And of course, we have to mention the very the very exciting news that the Department of Public Health's Jamaica Plain campus was named after Dr. Al DiMaria this year. The Public Health Museum, board and volunteers, and the entire public health world in Massachusetts, are really, I think this is a long overdue recognition for all of your contributions. And so we're just really proud of you. And again, I really can't emphasize it enough. We could not do what we do without our volunteers. This is most of them in the photo here. Each one brings something different to the table. They contribute to the museum in all different ways, whether it's tours for our visitors, working with the collection, doing genealogy requests, helping with special events. Like I said, whether you're there every week or a couple times a year, we're just so lucky to have you, and we hope to have you all back next year too.
Great.
And a big thank you to Paul. He is one of the most dedicated volunteers that we have. He has also made the decision this year to kind of take a step back, but we won't let him go that easily. He has agreed to stick around to train his his successor. So Paul was really instrumental when it came to our campus tours, learning all the history of the buildings, the evolution of the campus, all the different types of architecture represented on the campus of Tewksbury Hospital, knowledge about the trees, he just really delighted visitors. And of course, he would be there also working behind the scenes, emptying our dehumidifiers on the weekends when, either Amber couldn't be there or nobody else could. So thank you, Paul. We had a big celebration for Paul. Was that a month or two ago now? But without him, we wouldn't have some of our exhibits. So he's really just been a huge asset to the museum, and he will certainly be missed. And of course, thank you to all of you who continue to support the museum, whether it's by just commenting on a post on our Facebook page or attending one of our programs, or just spreading the word about the museum. We appreciate all of you being here tonight. I'm happy to, if folks have questions about operations or just want to make comments, we'll keep the meeting going for just another minute or two. But again, thank you. And fellow board members, please feel free to jump in.